Step 18, screening test. Before doing IVF treatment cycle, you need to undergo certain compulsory screening tests. It's very important to again stay on top of screening tests so that when you're starting IVF, you won't be told that, oh, this test is expired, or you haven't done this test, you cannot start IVF. To reduce your level of stress before and during IVF treatment cycle, please go through this checklist I will give you to ensure that you are up to date with your screenings. And also, of course, your clinic may have specific screenings which is not listed here. You need to find out and then ensure that your screening tests are up to date. And both we do female and male screenings generally. I will explain what tests are compulsory generally and the purpose of those tests. First, before undergoing IVF, you need to have a test for blood-borne viruses. For blood-borne viruses, these are HIV, hepatitis B, hepatitis C, and syphilis. The purpose of this test is to ensure that you are ready to get pregnant and you don't have any medical problems which need to be addressed before pregnancy. That's first. And also to reduce a risk of transmission any of these conditions to the baby. And also for the staff of the clinic to be aware if there are any risk of contamination or any risk of transmission of these problems to staff if they have needle stick injury, any of these problems. Then STIs, chlamydia and gonorrhea, because in IVF you undergo pelvic procedures. If you have any of STIs, they need to be treated to reduce risk of PID. And also you have a screening for rubella and chickenpox, generally to have a vaccination so that there's very little chance for the baby to have any problems. And also the cervical screening, because you can't do effective cervical screening during pregnancy. That's why you need to be up to date with cervical screening, and also different blood tests. Again, it depends on the requirement of your clinic. And you really need to find out what screening tests are compulsory, and you need to track the expiry dates, because you normally update these tests maybe yearly, maybe every 2 years. You really need to find out when your test is going to expire. Second, on the male side, it's more simpler, and all men should undergo screening for blood-borne viruses and STIs, and some clinics may have other requirements for screening. Again, understanding what is your clinic's requirement for screening tests and staying up to date with those tests is very important to reduce your stress before and during IVF treatment.